Good morning, it's 8 a.m., it's Las Vegas, it's March 3rd. And in this series of videos that I've been making for you, I've been sort of trying to give you an idea of what's going to happen in the future, okay? I'm trying to give you an idea of a few days, 2, 4, 10, 12 weeks into the future, combining a little bit of common sense with the current facts that we've seen, and we try to weave them into the tapestry of the United States. Because having the coronavirus in China is not like having the coronavirus in the United States. I'll just give you one reason that sums it up. When China knew that they were going to be quarantined and they went shopping for the last time, they didn't spend half of the individual people on their way home from work, when they went into the stores, they did not spend half their budget on ammunition. Anybody else want to admit they did? What? That's because the United States considers quarantine akin to going to war. I don't have any intent of going out and doing anything, but I don't have any intent of allowing anybody to come and do anything to me either. See my point? And if everybody else has ammunition, that's why Russia and the US didn't blow ourselves up, because everybody had ammunition. But a lot of you don't. Now, some very real things to consider about what's going to happen, because we're starting to see the changes now. I was in Costco on Sunday morning. I went early. I've already stacked up. I'm already more than prepared. I only went just to top off. When we got to the back of the store, they had roped off the water section in the back, just past like the cleaning stuff and the plastic bags at Costco. And as we came around the corner, there was a dozen other carts there. And woo, you could feel the tension there as people were... Some people went left down the cleaning aisle. They pulled back the ropes, and a bunch of us headed over to the 1 3/4 filled pallet that they had of water. Everybody surrounded the pallet, and there was no time to unload it. Even though it was Costco, that pallet was broken down. We got in there. We took 10 of the last 20 cases there of water. So there's no more water at Costco. And again, I've been reminding you guys that no time in your life here in the United States have you seen empty shelves where you could see the wall and the floor. And now when you watch the videos of Costco, dude, and I'm going to get into why that is so important in a little bit. And I'm going to tell you again why I have 100 days worth of supplies, not a weekend or a week's worth, like if this was a natural disaster like an earthquake where all the next states could truck over water, right? Because let me just ask, if you're here in any of these states right here, right? If you're here in any of the West Coast down here and everybody's infected, are they going to be trucking water into the Midwest? And then when the Midwest isn't infected, do they want infected Californians driving in? I mean, you guys have been already petitioning the courts not to let the military bring coronavirus through. Shit, we should have brought it home a long time ago and just got everybody sick slowly. Shit, that would have been the easiest thing for the government to do, right? Give it to the United States like chicken pox, because they're saying 70% of the people are going to get it. We should have controlled how it happened. I've been saying that from the beginning. Bring it home like chicken pox. Just do it in such a way that we slow the United States down, bring most of the respiratory equipment, because if you remember in China, and this is going to be a big deal, in China they built one centralized location for sick people to go to. We don't do that in the United States, and we don't take care of our elderly at home like they do in China. We have them in facilities. See, right here, Oregon, Washington. Where is the first targeted breakout? Seattle, Washington, I mean, sorry. Where's the first breakout? At a facility. 24 people. Bullshit. If you have 24 people there, that means that there were like 5 patients, 4 management, 3 nurses, 2 CNAs, 1 respiratory therapist, and 4 cooks. Think about what it takes to run a facility like a boat. Everything happens right there. Think about all the pharmacies that deliver drugs to that facility in Seattle. I don't think you guys understand the way a facility works. I'm blown away going there. You can't believe the amount of dead people they're keeping alive. in a facility. You should go tour a facility sometime. Just see how contractured, twisted, brain dead, on a ventilator machine people are. You wouldn't want to live that way, and the United States doesn't deal with its dead and dying very well. We seem to be very ashamed and shy of it. We seem to shy away. Now, this number is 106 now. And what you're going to find out is that the number doubles about once a week. It might be a little slower here in the United States. Let's hope so. Let's hope it's a lot slower. But this number, now they're going to trickle it in, so it won't seem like that. But if you look down here at the graph of that, you see the two red lines, that two big ones? Those are the days that China changed the way they reported their data. Okay? And this is going to be a number show. I'm just going to put things together for you. I'm just going to give you some numbers, and I'm going to interpret them without any bias. I don't have any advertisers. I want you and the United States to win, and we can totally do this if we just do a couple of things. Even right now, we could, even right now with this, out here in Seattle, we could totally do this. It's unfortunate what happened with Costco and all the supplies and all the stores, because people with money and able to go about their business wiped everything out. What do the older people do? What do the people with food stamps do when I bought it before food stamp day? What do assistance people do, right? What do all these other people do? Because I already own 100 cases of water. I'm not going to sell them in a Corona, quarantine kit, which I wanted to do, but nobody around me would let me. But what do they do? And that's going to become critical here when I give you the numbers later in this video. But think about that. Now, they're starting to close schools. We know it's going to happen, right? The number's going to double. They're going to start to close schools. They're going to be, right here is, they're already closing schools. They're closing Jewish school in New York here, right? So now we've got 2 schools closing. And as this narrow corridor right here comes right through the United States, you could see just the angle of it. Whoop, right down through the coast. Whoop, right up along the edge. Whoop, right by all our ports. Right where the tallest buildings are. Just like in China, right there. Where the tallest buildings are. Those are the problems they're going to have. And it's going to build quick on the East Coast. But it's those it's the respiratory machines. See, here's the problem. We've spread out all over the place. What China did was they centralized medical care. Okay? By centralizing medical care, all the nurses, all the CNAs, everybody knows where to report to. Then what they do is they know the nurses are going to get sick. So they take nurses from everywhere around and they funnel them through a couple of hospitals, and as they get sick, they get taken care of. Then, 2 or 3 weeks later, as we start to see the numbers build in another city, they funnel the sick ones back out and through to hospitals in other cities. They've had 3 months of this. It's been since December, January, February, and that's if you believe the December number. And you're not saying it was November. I'm not saying that China lies about their numbers. They don't. I'm saying the opposite. I'm saying that there's no way to really know. So the numbers that you see, whether that be new confirmed or recovered, or the actual numbers, logarithmic, all I'm saying is these are the daily cases. There are lots of different ways to line up the numbers. Okay, there are lots of different ways to line up the numbers. And where that spike is, China changed their reporting. Here in the United States, we change our reporting too. So why isn't anybody saying they're lying to us? They were testing cases, and then they found out the tests. They found out the tests don't even work, and they were contaminated, and they give you false readings. Okay, are they lying to us? And neither was China. And that's because the government is paralyzed. I don't care what affiliation you have. The government is paralyzed. We haven't seen one person want to step up and take responsibility for just a soft landing. Here is an opportunity for every government official, anybody in government, to make a video with a whiteboard. They don't even need a green screen like I do. All they need is a damn whiteboard. and you could just, you know what I mean, just flip it, just do like Ross Perot did. One government official, take charge. Not one of those fuckers can do it. Here I am, I already know what's going to happen next. And not only have I identified what happens next, I watched what happened in China. Therefore, to some extent, I can predict what happens after what happens next. And by knowing the obstacles, I can avoid them. It is a very simple thing to deal with the coronavirus in the United States. It is a very simple thing right now. Soon as we ran out of supplies at the supermarket, by the government not coming in and locking down the supermarkets and intelligently distributing food, what we have done is we have created little kingdoms. What do you want? You need a case of water? I've got 100. Do you need some food? I've got... What they've done is they've forced themselves to distribute food earlier rather than later. And they're going to have to distribute food across the entire country. This is not, oh, Florida, oh, you had another hurricane and you keep still rebuilding. Oh, New Orleans, oh, you filled up the basins with more houses. That was smart of you to build them 10 feet off the ground, I guess. But where else are you going to go, right? Okay. This is not some place where you park the trucks outside the zone and drive in, because the truckers are sick. The shelves are empty. I don't think you understand the significance of shelves being empty, both mentally and mathematically. And I'm going to tell you about empty shelves, the math behind an empty shelf, in a minute. Okay, so how do we come together with all of this? We've got all this going on. You can see it right here on the West Coast, right? I mean, you just see it right here on the West Coast. Look at that. See this dot? It's just like it was in China. This is going to get bigger and bigger. The dots around it are going to get bigger and bigger. The dots are going to move inland. They're going to come inland from the East Coast and from both sides, the Midwest, up north, you know what I mean, down in the, oh, even from the bottom, from Mexico up. We know this. And we know we're 9 meals away from anarchy. And yet the government let people go in and unfairly distribute a resource that should not have been let go. Come on. Should not have been released the way it was. They don't, how come nobody understands our resources? Fundamentally, the supermarkets and the supply chains, we knew this was coming. It should have immediately tripled and sent out all of the food, stocked them in the stores, and they should have been more careful with that resource. And yet they weren't careful with the stores. What's going to happen with fuel? No one's going to drive, so it won't be a problem this time. But there's no marshaling of resources. There's no official saying, I got this. And this is an easy one. I mean, haven't we learned from every one of the reality show competitions that somebody comes forth and says something? I mean, that's how you step forward. Just watch, step forward, take the risk, make it look good. This one's easy too. Everybody wants leadership because they're scared. And they don't even know the half of it yet. Okay. If the number doubles every week, and we go from 100 to 200 to 400 to 800 to 1632, 64, 12,800, 25,600. 50,000. That's 10 weeks if we double our number. 10 weeks, 50,000. Okay, at 50,000, when we got to that number with Wuhan, they were still under quarantine. Okay, I know they have 11 million people, they live in 2 buildings, and they all come out, they're the same in the morning on their way to work. I get it. They all line up in the streets and do calisthenics. I get it. But the United States is much whiter. You know what I mean? Everybody in the United States goes out on their porch and smokes cigarette and drinks coffee. That's fine. No problem with that. But we do have the East Coast here who's very tall. We have San Francisco down here, the buildings, in Seattle where the buildings are tall. And tall buildings have a different rate of infection than flat. So if you're steel, if your city's made out of steel, you know what I mean? You're beyond 6 stories tall versus wooden nails, which is 3 to 6 stories tall. If you're more vertical than horizontal, that changes the way your city's going to experience the virus. right? So being so wide and so short here in the United States, we're going to see a different distribution. And that's 10 weeks to 50,000 if it happens as quick as it seemed to have happened over there. Even with that spike you see in the way we changed our counting. And the United States doesn't count any better, but we don't have to count. We all know what's going to happen. Old people are going to die, and nobody has a more decentralized elderly network than the United States. Every other world, every other country has all their old people at home. We put them in facilities. No wonder Seattle had the first breakout. And my job is going to facilities. I see what happens there. I watch the CNAs go tag team a patient, change them, clean them, boom. And listen, when I tell you today's medical system, I have never in my years of doing this ever seen a patient where I was like, hey, is someone going to change or take care of this, clean this patient? I have never. I remember 1976 facilities. They were dirty. The nurses and the CNAs are fantastic. And when you see one of those videos of an elderly person in a chair behind the nurses station passed out, and you post comments like, how come no one's tending to her? You don't understand. That's the most coveted position in all of the facility, behind the nurses station, where maybe you could watch like a little movie on one of the computer screens. You guys have no idea what it's like. And there is nobody, if you want to have a day in the United States for somebody, you should have CNA Day. Woo! CNA Day. You want, maybe like twice a year. Because I go in and they pay me a bunch of money to do what I do. And the CNA cleans up the patient before I get there, so they're all pristine and shiny. Same patient, same infectious risk, CEO money versus not CEO money. You know what I'm saying? And that's fine. I mean, I went to school longer. I have a different set of skills. But in terms of their job, woo, CNA Day twice a year. Okay. You have to understand that the government's not lying when they tell us numbers. This is the best they can do. It is obviously the best they can do, because if they were doing better, I wouldn't be making this video, okay? Now, we're going to start to see school closures. It has happened on the East Coast already. It's going to happen here. We've already seen student at school, and they're disinfecting the school. What happens when they get the second student? Duh. I mean, it's spreading. So don't disinfect the school. Send everybody home. Take that resource and do something real with it, rather than sweeping the shit up behind the horses in the parade. Plug their ass before you send them down. You know what I mean? I'm just saying. We can direct our resources. And here in the United States, we never lead by example. If the government was out right now talking about ways that we should behave, if they were marshaling our resources and we felt confident, we could be confident. But I spent half my budget on ammunition because I'm not confident. Are you? Oh, perhaps you should prepare. You might want to, and yet I was prepared when it happened in China. Duh, I went out and bought stuff then. They're not doing anything to lead by example. And that's the momentum I'm talking about. The closer you get to impact, the more momentum required, the steeper the angle to shift. Here in the United States, if we're not slowly letting it move through the United States and taking our limited ventilator resource as it goes, we have no hope. If the hospitals are hoarding their ventilators, and we know that there's 70,000 ventilators in the United States, then how do we distribute that if on the West Coast, right here, we see that it's already building? And I will tell you, California has 40 million people in it. Michigan has 10 million people in it. 40 million people in California. There's 350 million people in the United States. California has like literally 9% of the entire population. At 40 million people, what's the probability? I mean, there's 40 million there, and there were 11 million in Wuhan. And they had respirators all in one area. They brought those people there. They had the trained staff all go to one location. Because what happens if 2 people are alive at a respirator at one facility and 3 people are alive on a respirator in another facility and nobody's alive and the respiratory therapist is sitting there? You have 3 people that could essentially do 40 patients but are each at their own facility. The United States is not marshaling its resources and focusing our energy. Oh, what happened to me? We're so big. We're kick fucking ass. We're the police of the world. And listen, I'm pro-USA. Don't think me doing this is not. I want the USA to be like, the guy's right. Why aren't we doing this? If this number takes 10 weeks to double, 10 weeks to get to 100,000, and if this number 100,000 is just this part right here on the West Coast with a tiny smattering of over there, what about everybody in the middle? I mean, there's 40 million people in California, 11 million people in Wuhan, and they didn't have enough respirators. Even if they let the GORC patients that are never gonna move or think again die, here where I am, it's a dozen facilities with 40 respirators. Which one are you gonna get? And are you gonna get a respiratory nurse that shows up and knows how to use it? Absolutely not. Absolutely not. And then, if we do decide to make the decision to take some people off the respirator that have no chance of surviving versus someone that does, you're looking at you know what, I'll give you a hard one. You're looking at Jennifer, one of 32 years old, bent up, twisted, missing a leg. No eyes, both fall to the side, and has to be suctioned, and has been that way. She's, I think she's like 32, and she's been that way for 5-6 years now. I almost can't even find a vein in her anymore. I've started to write poor bedside candidate. Now, you have 32-year-old Jennifer, who's just graduated college and is really moving out into the workforce, and really is an engineering degree in bioscience and viral infection. Who's the one that pulls the tube out of the dead for 5 years? Jennifer wipes it off and sticks it down to Jennifer with an engineering degree. Who does that? And let's talk about when and how. Who is going to pull Jen off the respirator so Jennifer can live? Do we set the standards now? Is there going to be somebody where you're just like, listen, we need you to go around all the facilities and give everybody the shot that you don't think is going to make it? Are we going to have a death czar in each state? I'm for it. I'm not saying I'm not against it. I mean, it sucks. But once you pull the tube out of Jennifer and you put it in Jen, are you going to have somebody bag that Jennifer until the vent can come back? We have the opportunity right now to reinvent the medical system on who lives, who dies, take religion out of it. Let's make it all about taxes and business because the United States is a business. And let's do it like that. Is it sad? Yes. I'm sorry, daughter, brain dead, but if you want to keep her alive, you take her home. Or find some religion who's going to pay for it. But religion's not allowed to lobby the government to keep people alive because killing people is a bad thing. That's not what the tax dollars are for. Our government is a business, okay? And as a business, occasionally you have to take a hit. You have to invest in yourself. We're investing in jails right now, right? That's not the carrot. That's not even a stick. That's digging your own grave as a country. Now, as this number doubles, how does it go across the United States? Because that's 10 weeks. Now think about 10 weeks, okay? 40 million people, California, okay? That's 10 weeks. Let's look back at the shelves and what that takes. When I went to Vaughn's and had them load up the 40 cases of water, because my credit card didn't work over the internet, so they called me instead of delivering it. I went down there, used my credit card, and it worked in the store. They gave me another 40 cases of water. I asked the lady, the manager, how many items they had in the store. She didn't know. But let's say a store has 1,000 items, okay? 1,000 different items. And let's say that they have 10,000 things in the store. Some might have 2 on the shelf, some might have 20. But let's say there's 10,000 items in the store, okay? Not different, just 10,000 things you could buy, but only 1,000 selection. I asked her this: what percentage of your store is purchased between shipments? And she had no idea what I even meant. So here's what I'm gonna ask you to think about. Let's say that the store gets a shipment twice a week. So they get pallets twice a week. How much of the store do you think is being replaced? And so what I'm going to tell you is I bet the number's 3 to 5%. Okay? Let's just say 5% for each pallet. That means that there's 10% of the store is sold every week. That seems like a reasonable number. 20% seems like a lot. 50% seems inaccurate. But let's say 25% of the store. 25% of the store. 20% of the store is sold every week. If 20% of the store is sold every week, and they're getting a shipment 2 times a week, okay? If the store gets bought out, and I don't care about the clothes hanging in Walmart, if the grocery side gets bought out and 20% of the groceries are sold every week, that means it would take 5 times the amount of deliveries, the amount of average delivery, 5 times the amount of average delivery to restock the store. And you would have to find people to get it on the shelves, and then you would have to prevent the people from coming in. I mean, you'd have to switch right. Oh, that's what Walmart and everybody should have done. They should have switched right to online delivery only. Although, there you go. Now we eliminated the disenfranchised and old people again, right? Because they don't know how to do that. Okay. If it takes, that's 20%. If the store sells 10%, it would be 10 times the amount of pallets to restock the store. 10 times the amount of trucks. And then think about all the stores. It would have to happen simultaneously, because if you restocked one Walmart, what the fuck happens to all the other Walmarts? And if you just do Walmarts, everybody's going to swamp Walmarts. What about Target? If Target gets it and Walmart doesn't, how are you going to distribute the food on the back end? We already have a problem right now because people with no money, people that are not paying attention. I got a mani-pedi yesterday. I said, hey, do you got a kid? She said, yes. I said, how much extra formula do you have? And she said, none. And I said, huh. She goes, I get food stamps tomorrow. And I said, excellent. I gave her a tip. I'm like, if I tip you out solid, would you spend it on your kid? She said, yeah, and I did. Whatever, I'll have to see her again at some point. Okay. I went to Vaughn's yesterday and got 40 cases, and there was still another 50 of a different kind of water on the floor. So we're not quite there yet, right? But you saw the videos of Costco. If it's going to take 5 to 10 times the amount of shipments, and they were getting 20% a week, and then if they're not waiting at the ports to be brought in, that means not only at the end of the coronavirus are we going to have, in the middle of the coronavirus, are we going to have a problem with food? It's going to extend past the end. Because it's not like you guys all bought a bag of rice and you're just going to heat it up and, I don't really know how to cook rice. But, I mean, that's the electricity stays on. Because I keep making that joke about the United States rioting, where China just, the last person out bowed and turned off the lights. You know what I mean? They don't even lock the door. It's China. I bet they don't lock the door. I don't really know. But I would imagine that they don't even have to lock the door. So if we burn down our infrastructure, and you know we're going to burn down certain parts of our infrastructure, MLK and Washington in every city in the United States will burn itself down. I bet. I bet it's so close to every city that I'm right. Think about it. You're going to take the most disenfranchised people and you're going to ask to lock them down with a higher proportion of children in the lowest economic portion of our community, and we're going to give them just enough money that they can't survive for 2 or 4 weeks at a time without their next EBT cards. Old people, young people, don't care. We have the sickest old people in the United States. The number of deaths in the United States is going to make the rest of the world look like fools. Sorry, the other way around. We're going to look like fools to the rest of the world because of how many people are going to die here in the United States. I'm a paramedic nurse. Have you ever taken a gurney into a casino and see how many fat CHF people are sitting with their huge yellow crooked fingernails in front of slot machines? They pull the chairs out from the slot machine and they wheel their scooter right up to it. Listen, everyone deserves the right to live and enjoy themselves. That's not what I'm pointing out. Do you know how many skinny plaid shirt wearing COPD patients are at the bar smoking and drinking? You're not going to get medical help because they're going to go down first and they're going to get the ventilator. By feeding the pigeons, the sickest and poorest people, by not solving this problem a long time ago, they are going to get your ventilator. Oh, the homeless. The homeless are going to get your ventilator. So they're going to take the people that shouldn't be alive anyway. They're going to put those ventilators in the homeless, the indigent, right? The ones who have CHF and the comorbidity and dialysis and diabetes and all of these other medical conditions that are already there, and they're going to get a ventilator. Then, by the time this moves out of California and into the Midwest, those people are going to come off the ventilator and they're going to go put them in people in the Midwest, maybe middle class or upper class. Maybe by then all the homeless will have died off. I mean, I'm not suggesting that San Francisco engineered this coronavirus, sent it to China as a false flag, and then had it brought back here to kill off all our homeless people. Although, the one has crossed my mind. I mean, has it crossed your mind? San Francisco engineered this to deal with all the needles and hepatitis in their city. I bought 4 months of food for me and my family because I don't think anybody else understands the math behind the spread. Because if this 20% of the store gets bought out, how can they possibly restock the United States? They would have to be distributing food and formula while restocking the shelves. I keep telling you, it's not the coronavirus that's going to kill you. You do not have to worry about that. Unless you're poor, old, have comorbidity conditions. But I'm telling you, the coronavirus is the euthanizer. It's going to turn our country into a much lower average age of population. Right? I mean, look who it doesn't kill babies. And the United States government will kill the babies because they're not distributing food to protect the babies. So the United States government will allow all of the babies to die. That's unfortunate. I mean, this should be solved already. So the United States will allow the babies to die. I understand the old people. I understand the people that shouldn't be alive anyway. But we have the opportunity right now to come out the other side of this. A stronger, leaner nation. Let it ravage through the United States. But again, you have a higher chance of being killed by a lone gunman who finally doesn't have any police or emergency people to deal with. You are going to get burned out of your house by uncontrolled arsonists. Don't you remember when Rodney King got beat? I watched it on the news. Reginald Denny got beat and pulled out of his truck. They started that riot right there. And I watched the fires. Bloop, bloop, bloop. And then who's ever starting them turn left. Bloop, bloop, bloop. It was somebody who was driving down the street throwing Molotov cocktails. How are you going to stop that? You're not going to die of the coronavirus. You're going to die from an addict who can't. You know how many people we have living in the tunnel up the street from me? Oh my God, it rained. They've got all their stuff on the side of the ditch, on the side of the flood channel drying out. I had no idea how much stuff they had to bring it all out because of the flood. Oh my God. The homeless people in the tunnel people, not even the homeless people in the field across the street. Dude, we're gonna have our next generation is gonna be tunnel people. Because they're gonna survive. Duh! I feel bad for the people in the houses. You wake up in the morning, open it up, look down in the ditch, and there's just like clothes like it's a flea market drying on the sidewalls of the flood channel. We can't even deal with that on a good day. We can't even deal with our homeless on a good day. On a good day, our emergency system is overtaxed. On a good day. They're all businesses. All of these businesses are designed to operate on lean conditions, to maximize profits. It is not like the United States has said, let's build a team, keep them trained, right? So we have, we have like the Peace Corps. I can't understand why each city doesn't have this aggressive medical corps. Why we're not, we should have a medical corps for no other reason that if you join the medical corps, the government in the United States will pay for your doctor school over time, and then you have to work at county facilities for 10 years. They can't even do that. The United States can't even come up with a medical corps. It's the goddamn Boy Scouts for adults with a channel to get, it's a goddamn youth group. No. I don't even know what to say anymore because of all the problems youth groups have. It's just, but you see my point though. Why isn't there, if we don't have enough doctors, why isn't there a free system where anybody can come in and through working, I'm a paramedic nurse. I do the smallest surgery in the world. There should be you want me to be a surgeon. The United States wants me to be a surgeon. Dude, my hands are spectacular. With what I can do and see. I'm just saying that the opportunity, the United States doesn't, there's no encouragement. And the one solar thing I saw them do, it seemed to have failed with $400-some million. The United States is a very poor leader. The leadership is a very poor leader. I haven't heard anybody since Kennedy, and I wasn't born when he said it, but really say, we're going to go to the moon. We're all going to pull together. Let's do this. Oh, actually, we're going to beat Russia. Let's do this, right? Reagan said nope to dope. That was the biggest failure ever. And I guess I'm a Republican because I think the United States is a business and that we should remove everything out of it. If you don't drive, you shouldn't be paying the $2,900 a year tax. Or just on the fuel that you use, it should be $12 a gallon. Covers your insurance too. Think about that. So, yeah, the government doesn't even have to, you'd never tax another citizen if I was president. But hey, if you don't have schools, you wouldn't be paying for school. The state could deal with the jails and stuff like that. Federal government deal with something like that. But what are we going to do with the people in jail? Are we going to release them all? Are we going to wait till the coronavirus numbers hits like this and then start counting jails? Are we going to use like the jails for the coronavirus? We saw what happened on the cruise ship. There's nothing happening, and the length of with which this virus is going to take us to recover, you haven't heard one person besides me tell you. You have to understand what the numbers are telling you without advertising. Without advertising. Actual number of recovered is rising. Okay, that's fine. We expect that. Daily cases, we want actual, what was the original? This one. Mainland China, other locations is growing. China has 4 billion people, right? China has 4 billion people. Asia, maybe China. Yeah, China, I think. 4 billion people. Let's just say Asia has 4 billion people. Do you think the rest of it on the way up to Russia, that's only where the cities were, where these were? Is that only where the cities were? Right there. Okay. So 4 billion people gives us what? 4 billion people gives us 80,000 infections in 12 weeks, 3 months? Okay. But is that 80,000 on 4 billion? What's that out of? Is that 80,000 out of 100,000? And you go, oh, 80% of the population is going to get it. Is this just the first wave? Out of 80,000, out of what? Out of what? What is the sample group? What is the size of the community? They keep saying 11 million people in Wuhan, but they keep saying 80,000 people infected. And you know it's not Wuhan only. Because there's Wuhan. They don't even have a red dot anymore. I guess it's gone. See how big these red dots are? See how big those red dots are? Now imagine those red dots. All throughout the United States. Imagine not being able to see the United States through that many red dots. You can't see our country through this many red dots. There's the United States right there. Only we have 350 million people. So if that area looks like the United States or the East Coast or West Coast, do we have 80,000 on the East Coast and 80,000 on the West Coast? That's 160,000. 80,000 out of how fucking many? You've never heard that number once. Because if it's 80,000 out of 350 million and the number is declining, great. Then the United States has a chance of getting 80,000. And remember, the longer the virus takes to finish its trip around the world, if it doesn't go twice, the longer the virus takes to finish, you know what I mean? The higher the probability of a variant comes out that's more lethal or different and then moves around the world. Because remember, there are more viruses in one patient than people throughout the history of humanity. One patient carries more viruses. And you know viruses like to mutate. Look, SARS wasn't transmissible. Okay, let's go back to HIV. HIV turned out to be one community in the beginning. It took too long of a time. If you've noticed, the viruses have been building in the same way. Boom, you got MERS, there's respiratory, SARS didn't really take hold. What was the problem? Not transmissible enough. That's why we never had a Johns Hopkins map like this. Now, we've got the virus figured it out, right? I mean, the virus is just like humanity. Well, more like the United States, maybe Iran. We're going to take over and blow this shit up. We mean it economically and financially. Iran means it literally. They're just going to blow stuff up. That's what they do. But it's right here. 80,000 out of what? 80,000 out of what? If it's 80,000 out of 350 million, okay. The ventilators may not be a problem. We'll slow roll it across the United States. But what about the supply chain? It's going to take 5 times the amount of supplies to fill up the stores. And that's if the store sells 20% a week. If it sells 10% a week, it's going to take 10 times the amount of supplies to fill up the stores. Now, let's say we don't really need 10 times the amount of supplies, right? So if 20% of the store is bought out every week, that's fine. If we can just get 40% in there. Okay, but that's 40% if nobody needs anything. What happens if people are 50% behind? Now they're going to be stocking up. I'm not quite sure what that means because you see those crazy coupon people with 200 tubs of salt. You know what I mean? But let's talk about the supplies for baby food. Is there a channel to distribute baby food? Let's talk about the medication. You know that there's nowhere else in the world that if you're fat and a smoker and diabetic, you know there's nowhere else in the world that gives you medication until you stop smoking, lose weight, and then we'll see if you're not a diabetic anymore. Why do you think America sends HIV meds to other countries? Because they're not going to do it for their own people. We shouldn't be doing it. Let the religious nuts do it. They want to save them. You go there and do it. You got the commercials in the middle of the night. Put up a commercial that says, hey, HIV drugs. And then show the country and the city and the people that they're in. Don't just show little kids. Like in India, there were reports where all I'm saying is when everybody's asking for help, there's nobody going to be left to help. We don't have to know the course of the virus any more than we know right now, because the virus is not going to be what kills. 99% of the people that die will not be from the virus in the United States. You will get killed by an addict looking for a fix, because that's what addicts do now, and they still have a supply chain. You are going to be killed and burned out of your house, murdered, raped, whatever it is you think. If we let parts of our country burn early, it only exacerbates the problem for the remainder time, right? That's like if you get hurt at the beginning of a natural disaster, ooh, it chopped off your finger. You're going to be under shock, in stress for the rest of that natural disaster. You know what I mean? You may get an infection and no medicine to get it. When I stopped going to work, which is, I'm running as few calls as I possibly can now. And as soon as you see these dots right here, as soon as you see them in Las Vegas, I'm out. While my job pays good money for a high-risk job, I do a very high-risk job. I deal with the sickest patients, the most infectious patients in the medical system. I'm not the only one. I deal with the most infectious patients in the medical system. But if you take one of these red dots and you put it on the black dot that is Las Vegas, one red dot covers all of Las Vegas. And if you look at who the first one to get infected is, it was a facility in Seattle. It was the facility in Seattle right here. Facility in Seattle right here. They were the first one, and it wasn't a little outbreak. There were like 25 of them, and that's because whoever's telling you about it doesn't understand the significance of it. I'm the vendor. When you read the article and it says it blocks visitors and vendors, that's me. I'm a vendor. I wear a tag on my hook when I go in, and I'm a vendor. I'm not going to go put pics in people with, I know it says paramedic nurse, and I used to be a paramedic and a hero, and it was my job to go in first. It is not my job to go in first anymore. And I'm not going to be a hero by going in first. I'm going to get the coronavirus. And I'm 50 years old now. This year. A couple months. So I'm now part of the euthanized group. I don't need that. Go send somebody else in. Or renegotiate my salary or something. You know what I mean? Give me some sort of bonus up front and a higher rate per, because now I'm going in a combat zone. I don't know how the CNAs are going to work for $12 an hour, $10 an hour. They're crazy. And soon as they leave, soon as the CNAs leave, it's over for the facility. The nurses are too pressed for time now passing out meds. And what's the first place addicts are going to go kill people and take all the meds? Duh, pharmacies. And then where? Duh, facilities. Duh. You know where they are. They're at pharmacies and they're at facilities because the facilities have pharmacies too. Duh. What's there to lose? There's no police department. Now there's no meds in the facility, so everybody's going to die. When this starts, think about the people in that facility right now, right here in Seattle. Think about the facility people in this facility right here in Seattle. Are the patients going to be kept in there? Okay. How are you going to get nurses to treat them? Now, what about when all the other facilities in Seattle, because every nurse works everywhere. Every nurse has 2 or 3 jobs. There's not enough nurses. Every nurse has 2 or 3 jobs. Ruh-roh! If they got infected 3 weeks ago, you know, and didn't show symptoms for 2 weeks, and now they're showing symptoms enough to quarantine the place, what do you think's going to happen next week when the number doubles, and then doubles and doubles? It's going to go through all the facilities first. It can't do that in China because they don't have facilities like that. I'm going to tell you that African Americans will have it the worst. I am going to make that prediction right now. African Americans will be affected by the coronavirus the worst. If you read my book, Tales from the Gurney, there are lots of stories about blacks, gangstas, brothers. There are stories about African Americans in there as well. Yeah, there are different kinds of white people. There's different types of black people. Different communities of black people. I mean types, you know what I mean? Different communities of black people. If you go to a facility like I do, what you'll notice first is the absence of 68-year-old African American males or older. There aren't too many 85-year-old African Americans. So if you go to a facility with 100 people in there, like 3 are going to be older, 69 or older, 72 or older. 3 of the whole place. There will be up to 7 African American females. Woo! There, in all the land, there is nobody stronger, both here and here. There is nobody stronger than the African American elderly female. Woo! They are patient. Not in a negative way, 100% positive. There is no patient I respect more than the African American female patient, 65s and up. There's no character in the United States that has seen and gone through more than the African American male and female 65 and older. But they don't live. Even when I was on my ambulance, if you get an African American with the flu above 50, put them on oxygen and take them to the hospital right away, because no one is going to get crashed faster from the flu than African Americans, seniors. Nobody in my ambulance ever crashed harder than African Americans in the flu. And there aren't in the facility, so you guys aren't living as long. I'm sure in facilities where the African American communities, where there are more African Americans, I'm sure the number is higher. But I'm sure the number of African Americans is higher. But I'm sure the number of 68 and older African Americans is far below Caucasian, and Hispanic is just slightly above African American. You guys all seem to die of cardiac related and like kidney related stuff a little bit earlier, lung related stuff a little bit earlier. So not only do you have a comorbidity of whatever it was that made you sick, lungs, African Americans and Mexicans, Hispanics, are going to have a higher rate also. And these are all things that I see just going around. I don't know why anybody else isn't telling you these things. I mean, they're going to the same facilities I am. The most long-lived thing seems to be old white ladies. They got bonkers. They got bonkers. But nobody seems to live longer than old white women. Asians, I don't see very many. In the United States here, I don't see very many Asians over 80. Although more African American, Hispanic, Asian. I mean, we're still way up here with, I don't ever see Indians, but I don't really know if there are. Native Americans, not Indias. Just something to consider. I mean, they're talking about all these statistics about how, and I'm talking about the numbers game of just looking at who already doesn't survive and applying that to the situation. I can't imagine the coronavirus is going to be beneficial for the African American AARP senior community. I want all you guys to be safe, but nobody, there is nobody, not in China, Not in the United States. There is nobody putting it all together for us. It's a simple thing. We know the next shipments of baby food have to go out. Let's make it safe for all the babies. I get it. I mean, China delivers stuff right up into a building. We can't do that here in the United States. We know, the fire department knows every fire hydrant, every apartment, every address. We can't turn that into an app, have people take that address, tell you who's in there, and then distribute food like we do the mail, where we put it, and then you go out and get it. We can't do that here in the United States. I'm just saying, it seems to be a lot of talk about how awesome we are, and yet it seems to be the shittiest results with the biggest fucking talkers. If you see your government doing anything other than helping you prepare for the coronavirus, what the fuck is wrong with them? My name's Jason. I'm a paramedic nurse. Stay safe. I hope you survive. I'm excited to see what happens next. I hope I'm still in the, not in the euthanasia side. You know what I mean? I want to end up on the other side and see what happens. I'll be like a senior by then. Stay safe. I wish you the best. I'll keep posting videos.